Infertility is a touching issue in our contemporary world in spite of medical advances in managing infertility. The success rate has remained low. Doctors define infertility as failure to conceive despite regular unprotected sex for a period of 12 months or more. The cause could be either from the male 30% or from the female 30%, from so-called male and female combined cause 15%, or from inexplicable causes 25%. Age of the couple, which is a mirror of the competence of the productive system, definitely influences fertility of the couple.
Infertility can easily be defined as a situation when a male and female living together, regularly cohabiting, that is, regularly having sexual intercourse without anything to prevent pregnancy, stay together, perform unprotected sex for upwards of 12 calendar months without the woman getting pregnant. This is basically the professional way of defining infertility. Research with modern medical facilities has revealed to the science world that the male's inability is about 30%, which is about the same thing of the inability of the female, which is the same 30%. And we talk about combined cause being about 15%, making that is 75%, while 25%, God knows why, is called the inexplicable. For example, we still give about 1% or below 1% to cases when the male sperm reacts to the fluid in the vaginal cavity.
Both testes hang within the scrotum outside the human cavity to maintain a relatively cooler temperature than inside, a condition needed to prevent destruction of spermatozoa structures. Unfortunately, many other factors ranging from diabetes mellitus, on the other hand, genetic abnormalities, workplace injuries and infections to the testes are factors that could influence spermatozoa quality and quantity. The tube through which these millions of spermatozoa flow through could be compromised one way or the other. The quality and quantity of the spermatozoa also is of great importance in the determination of infertility potentials.
Infertility in the male is caused by numerous causes, which culminates in the production of poor quality spermatozoa. Let's take it from the top. We talk about diseases that afflict the male. High on this list is diabetes mellitus. Because of the high quantity of sugar in circulation, the spermatozoa are adversely affected. Let's talk about the thyroid gland. The thyroid gland, when it is functioning or even hypofunctioning, causes a lot of damage to the performance of the man and also to the performance of the spermatozoa. We talk about situations just like in the female as well. The pituitary gland is overproducing prolactin, and because of this, so many things goes wrong in the male's immune system. We also have to mention the medical drugs that the males take, the antihypertensives that the males take, don't let me mention names, the anti-ulcer medicines that the males take, the anabolic steroids, and I have to state a stern warning to the youths who practice the consumption of large quantities of anabolic steroids just to look muscular. It destroys the formation of the spermatozoa. So they should forget about this and stop doing that. Now, a lot of hard drugs is being consumed in this part of the world now. This affects the function of the sperm cells. Cocaine, Indian hemp, alcohol are some of these things that cause disturbances in the quality of the sperm cells. Furthermore, we have genetic abnormalities developing from so many things. For example, the hormonal status of the male, the testosterone being insufficient makes the sperm cells not to be as active as would have been expected. For example, one simple thing that occurs in people of some professions, like the Okada riders, who sit on their testes almost throughout the whole day, creating such a squashing effect on the testes, makes the production of spermatozoa to be on the poor side. Apart from that, the heat generated there diminishes the quality of the sperm. Now, of course, sometimes we may have the blockage of the sperm duct caused by prostate problem, infections. We may have situations when the spermatozoa from the seminal vesicle, that is where the sperm cells are stored, instead of flowing downwards towards the tip of the penis, it flows backwards towards the bladder, a situation we call retrograde flow of sperm. And of course, in abnormal formation of the position of the exit of the urethra, that is where the sperm is ejaculated from. In some children where there are some anomalies, the hole is not at the tip of the penis but under the penis, and therefore when there is ejaculation, the sperm is not squirted, it is not released and pushed directly towards the cervix, and losing this ejecting prowess reduces the ability of fertilization by the sperm cells. Apart from that, we talk about males not having enough sperm, that is oligospermia. It's caused by a lot of things that damage this formation of the sperm cells. It's caused by infections of the testes, so on and so forth. But worse still are situations when not one single sperm cell is found in the ejaculated semen, a situation we call azoospermia. This can be managed in some cases, and even if it were not be possible to manage them, it is possible, for example, to take immature sperm cells from the testes, make them mature externally. These are new processes now, and this can be used during ICSI, that is in vitro fertilization cases, to successfully pregnate the fertile woman.
Causes of infertility in the female is multifaceted, starting from allergic reactions in the vagina to inappropriate central nervous system stimulation of the ovaries. It is obvious that a successful treatment of infertility demands a thorough investigation of its causes and then elimination of these problems by a competent expert.
Well, the free tips I'm going to give to the whole medical world originated from Health Forever Products Limited, the manufacturers of Jobelyn, and this herbal wonderful substance, antibiotics called Benabiotics. Now, the free tips I want to give to the whole medical world is that in cases of fallopian tube blockage, it has been discovered by that administration of Jobelyn through a period of 3 to 6 months, alongside this wonderful herbal antibiotic called Benabiotic, has resulted somehow, which I still cannot explain with concrete proofs, it has resulted in the reopening of the fallopian tube, and therefore has opened the possibility of pregnancy. Of course, free tip also includes consume foods that contain a lot of antioxidants. Reduce the quantity of cholesterol that you eat. Make sure that you are psychosocially stable. And last but not the least, Jobelyn and Benabiotic again.